Lockdowns and social distancing rules have been imposed without much sense. It's now fairly widely known that most of the people who've died from the virus or been ill with it were obese or diabetic or both. And many had more than 3 chronic diseases. The UK's Prime Minister probably suffered badly from the coronavirus because of his weight. So why haven't governments selectively protected the individuals most likely to be at risk? As I said back in March, it was nonsense to pick on perfectly fit over 70-year-olds to be the first to be put under house arrest. The current treatment of patients with cancer, heart disease and other dangerous but treatable diseases is a grotesque scandal which has taken healthcare back to the Middle Ages. Patients, doctors and nurses have all been betrayed by the profession's leaders and by their governments and governmental advisors. Mental health problems are growing too. In California, a hospital has reported that it's seen a year's worth of attempted suicides in just 4 weeks. It's the same with dentistry. In some countries, people with dental problems are being treated normally. I gather that in Ireland and Germany, for example, at least some dentists are providing treatment. In America, there seems to be some confusion about what is and is not allowed. In Britain, there's virtually no dental care available, though most dentists say they're well equipped with the necessary masks and gloves. Many dentists, particularly those in private practice, are desperate to get back to work. Dentists working for the government may still get paid, but private dentists are receiving nothing, and their insurance policies are probably not any good. Many dentists fear that they'll go bankrupt, and they're desperate to get back to seeing patients. Strangely, in the UK, it seems that no one within the dental profession itself seems to have the authority to force dentists not to work. The General Dental Council says it can't force dentists to close, and the Care Quality Commission also says that it can't force dentists to refuse to see patients. But dentists are closed because they're worried about the government's general lockdown and social distancing rules. And there will inevitably be insurance and legal worries too. There is, it's said, some sporadic emergency dental treatment available in some areas, but I've seen reports suggesting that the only service available is the removal of teeth, rather than attempts being made to keep teeth in place. All this could go on indefinitely. How the devil do you ever fill a bad tooth from 6 feet away? And although dentists and dental nurses can all wear masks, it's a little difficult for a dental patient to keep a mask on while they're having treatment. Meanwhile, millions of patients are missing essential dental work. Many are in agony and are desperate for relief. Hundreds of cases of mouth cancer will be missed. Patients with gum disease who need regular work to keep their mouths healthy will lose teeth that they didn't need to lose. All this is a tragedy and a scandal unlike any other. The leaders of the medical profession and the dental profession aren't doing anywhere near enough to end this appalling state of affairs. At least, I don't feel quite so lonely about this these days. 500 brave doctors in the United States agree with me and have told Donald Trump to end the coronavirus shutdown for the reasons I've explained. The bottom line is that patients who think they might have cancer are not being treated, even though everyone with a basic diploma in emptying bedpans knows that speed is of the essence when you're treating cancer. That's why doctors arrange screening programs, for heaven's sakes. Patients who had the first signs of cancer 3 months ago will, whatever happens now, have to wait another 3, 4, 5 or even 6 months for treatment, while the system catches up with the backlog. I'm angrier than I've ever been, and I'm incredibly disappointed with my former profession. A friend of ours who was diagnosed with cancer a few months ago is still waiting for her treatment to start. Meanwhile, her cancer, unhindered, is undoubtedly doing what cancer does best. It's growing. My wife found this on the internet. My cancer treatment has been cancelled and interrupted throughout this pandemic. I found it hard as the nurses allocated to advise and offer support have been redeployed onto empty COVID wards and so are unavailable to cancer patients. I felt quite alone and unimportant compared to virus sufferers. How can anyone not be angry at that? What the hell is going on? Are governments trying to kill people? Is this some crude population control plan? It's not as if the problem is unrecognised. Governments have admitted that thousands and thousands of patients will die because they're being denied treatment. In the UK, it's been admitted that the closure of health services could lead to 150,000 deaths, far, far more than will ever die from the coronavirus. And I think that figure is a massive underestimate. And I have to say that my estimates have been much better than the government's throughout this affair. The figures show that so far 60,000 people have died because they've been denied treatment. The majority of people who died from the coronavirus were over 80 years old and seriously ill with other diseases. They would, it is admitted, have died within a few months anyway. All tragedies, I admit, but this is exactly the same sort of way that flu usually kills so many people. But the patients with cancer being denied treatment are often otherwise healthy and frequently quite young. Around the world, tens of millions of operations have already been cancelled, and millions more get cancelled every week. All operations are essential, some more so than others. With a possible exception of some cosmetic surgery, no one has an operation they don't really need. Screening tests and investigations have also been abandoned and delayed. Patients with symptoms and signs of serious disease have been told they'll have to wait months to find out if their problem's likely to kill them or if it's benign. In such situations, the waiting is almost unbearable. Only those who know the awful pain of waiting for test results will understand just how terrible and inhuman the situation is at the moment. Moreover, doctors now report that vast numbers of patients have been so terrified by their government's hysterical overreaction to the risk that they won't go near a hospital in case they catch the coronavirus bug and die of that. Even when medical care is available, patients prefer to do nothing, and that problem is likely to persist until the hysteria is reversed.